Good morning, everyone. We are now live for our event today. Thank you for joining us for the American Academy of Pediatrics Nevada Chapter Virtual Walk with a Doc Kids Time. I'd like to welcome all of our parents, kids, and fellow practitioners to our March virtual walk. My name is Dr. Lily Hadaji. I'm a pediatrician here in Las Vegas, as well as the Nevada chapter of the AAP Walk with a Doc coordinator. So for almost 6 years now, the Nevada AAP chapter has been meeting every second Sunday of every month. We coordinate kid-friendly talks on a variety of pediatric health topics and then enjoy an outdoor walk together. It's a great way to get outdoors, learn important information about the health of our kids, and have the opportunity to ask a local pediatrician or pediatric specialist any questions. Our chapter also helps coordinate this event for the Reno community. So we normally join at the Springs Preserves outdoor venue most of the year, and during hotter summer months, we gather at the Mount Charleston Visitor Gateway to escape the heat. Since we're keeping our distance to help protect ourselves and our community from this pandemic, we're holding a virtual walk with a doc this morning, live streamed to online. For our talk today, we are very happy to welcome Dr. J.P. Vilay, who will be speaking to us about youth sports participation during the COVID-19 pandemic. Dr. Vilay is an assistant professor in the Department of Pediatrics at the UNLV School of Medicine. His passions lie in clinical care for the underserved population, children with chronic health care needs, as well as children with behavioral and mental health concerns. As Dr. Vilay starts his talk, I really encourage all of you to use the chat box to talk to each other and also ask any questions that he can answer at the conclusion of his talk. Dr. Vilay, we are ready when you are.
All right. Thank you so much, Dr. Hadaji. Just go ahead and just talk a little bit about COVID-19 and sports here. So what we've kind of been talking about recently is that, there are a lot of kids who are actually participating in sports. And so there's about, 45 million, they estimate, youth between 6 and 18 years of age who are participating in some form of athletics. But with the COVID-19 pandemic, it's really affected the way that a lot of children and families view sports and view the world in general. Parents and athletes tend to have some questions about how to ensure their safety when it comes to sports participation. And so the American Academy of Pediatrics has come out with some guidelines to decrease the risk and also to prevent the spread of COVID-19 when you're participating in sports. Having the COVID-19 vaccines available for ages 5 and up has been a game changer for many families. And being fully vaccinated can help kids stay healthy. And then fully vaccinated children and teens tend to not have as severe illnesses or multi-system inflammatory syndrome in children, or MIS-C, as you've kind of heard about. Any child or teen who's recently had COVID-19 should be screened before they resume physical activity, regardless of how severe the symptoms were. That can be done by phone with your pediatrician, it can be done by telemedicine, or it can be done in person. And also at that evaluation, we're looking for possible side effects of COVID-19, particularly on the heart. So we can kind of talk about this in terms of before the sports season starts, during the season, and then after the season. So before the sports season starts, you want to make sure you understand the rules of participation for sports during COVID-19. You can talk to your child about what that means, making sure your child has their own equipment, face mask, hand sanitizer, towels, water bottles, even tissues labeled with their name. You can call your pediatrician to make an appointment if your child needs a pre-participation sports physical, as most of us do if you're going to do sports. And that's also a good time to catch up on recommended vaccinations. If your child hasn't been active during the pandemic, I know I haven't been very active, now starting to get into it, you want to really ease into it. That helps to prevent injuries that sudden intense activity can cause in growing children, and it can also reduce the risk of heat-related illnesses in kids, particularly those affected by obesity. For example, if you're doing sports with a lot of running, you might consider beginning a running program, and you can do this. There are a few apps out there to help you. There's one called Couch to 5K, and there's one called None to Run. And these are kind of apps that you can get on your phone to help you with easing back into physical activity. Prior to practice or games, what we're looking at is If you have symptoms of COVID-19, probably best to isolate your child and test. Reminding your child to wash their hands before arriving and using hand sanitizer or soap and water isn't available. You want to bring your personal equipment with you, water bottle, towel, hand sanitizer, face mask. And then regardless of vaccination status, kids should wear their mask indoors in areas that have high transmission for COVID and with shared transportation as well. If you have had COVID-19, what are the thoughts that we have about returning to physical activity after that? So if your child has had a positive COVID-19 test, obviously you want to address that with your pediatrician, and they can advise you how long you need to wait before returning to exercise and sports. Basically, that's going to be based on how severe the symptoms were and whether they developed any signs of MIS-C, or that multi-system inflammatory syndrome in children, whether they had myocarditis or whether they had other symptoms. We break this down in terms of children who may have had no symptoms or mild symptoms of COVID-19 and no symptoms of MIS-C. These children just have to connect with their pediatrician, and they'll let you know if you need to isolate or advise you if you need to if you should refrain from exercising during that time. They'll also ask you about heart symptoms such as chest pain, shortness of breath, fatigue, irregular heartbeat, or fainting. Any child with positive heart screening is going to need to have an in-person visit and to complete a physical exam. The doctors will decide if you need also what's known as an electrocardiogram, or looking at your heart to see if you need additional testing or if you can be cleared for physical activity. For those children and teens who had moderate symptoms of COVID-19 and no signs of MIS-C, you should have an in-person visit with your doctor. And you should not exercise until the symptoms are gone and until they're able to be seen to be screened for possible side effects of COVID-19 on the heart and have a complete exam and an EKG. Moderate symptoms, when we talk about that, what we mean is 4 or more days of fever over 100.4, or a week or more of muscle aches, chills, or fatigue, and any hospital stay that was not in the intensive care unit or ICU. And the next steps depend on the cardiac screening and the EKG findings. If your child's heart screening is normal, they can gradually go back to physical activity once 10 days have passed from a positive test. The symptoms also should be gone without using any fever-reducing medicine like Tylenol or Motrin for at least about 10 days. And if your child has an abnormal EKG or heart screening, then there probably will be need to see a cardiologist at that point, a specialist in the heart, for possibly more tests. If you had a child or teen who was very sick from COVID-19 or actually was diagnosed with MIS-C, they must be treated as if they have an inflamed heart muscle or myocarditis. They might need other tests if they needed to stay in the ICU or they were intubated. So before your child leaves the hospital, they should have a plan to follow up with a cardiologist. After severe illness or MIS-C, exercise should be restricted for at least 3 to 6 months is what the recommendation is. And a pediatric cardiologist should examine the child before they can return to exercise. And the doctor will recommend a schedule of gradually getting you back into physical activity based on your age and how severe the symptoms were. So keeping in mind this, even if your child is cleared for activity, they will need to stop immediately if they experience any of these symptoms: chest pain, increased shortness of breath, sudden heart palpitations, or feeling faint or passing out. In those cases, it's important to see a pediatrician in person if they have any of those to rule out a heart issue. And during sports practice or games, if you're doing an outdoor sport, if you're not vaccinated, you should wear a face mask, especially on the sidelines and during all group training and competition that involves continually being within 3 feet or less from others. If you're doing indoor sports, anyone who's not vaccinated should wear a face mask for all indoor sports training, competition, and on the sidelines. And in counties with substantial or high transmission, athletes should also wear a mask for indoor training and competition, whether or not they're vaccinated. If your child takes off their mask during a break, they should stay at least 3 feet away from everyone else. Even if you're fully vaccinated, you should encourage your child to wear a mask in crowded indoor spaces like locker rooms, if you're using shared transportation, if you're walking to and from playing areas, between practice drills and on the sidelines. A couple of times when you might not wear a mask would be if you're doing water sports, obviously, like swimming or diving or water polo. And then if your mask becomes soaked or wet with sweat and so forth, you should change it right away. Certain exercises in competitive cheerleading and gymnastics is also, you want to maybe avoid wearing a mask because you don't want to get it caught on the equipment and create a choking hazard or block vision. But masks should go on after these exercises, especially if athletes can't stay 3 feet apart from each other. Face masks are also discouraged while wrestling, unless a coach or official is closely monitoring to ensure that masks don't become a choking hazard. And exceptions to mask wearing might also be appropriate if you have heat-related, if you have a risk of heat-related illness. And also minimizing sharing sports equipment when possible, and tell a coach or parent if you're not feeling well and you should leave the game or practice at that point. After practice, obviously, you want to sanitize or wash your hands, wash or replace face masks, towels, or other practice clothes, uniform, and clean personal sports equipment and water bottle as well. For more information, there's a great website called healthychildren.org. That's healthychildren.org, and we'll see that all over the place. And that's a place that you can go to find a lot of these guidelines that I just talked about, and also a lot of wealth of other information as well. So with that, Dr. Hadaji, are there any questions for me?
Yes, Dr. Vilay, I have a question for you. Do you recommend the COVID-19 vaccination in children 5 and older?
Absolutely. I think that that's really one of the most important ways and most easy ways to prevent COVID-19. And kids who are 5 and older, as you said, are eligible for the vaccine. They will get 1 dose, and then within about 3 weeks, get a second dose. And then children who are 12 and older should get a booster after about 5 months from getting that second dose. If you're immunocompromised, if your child is immunocompromised, you should also get 3 doses of the vaccine for that primary series, actually. So you get 1 dose, and then 3 weeks later, the second dose, and then about 4 weeks later, the third dose. And if your child is above 12 years old, they're still recommending a booster at that time. So I do recommend that. I think that's a great idea.
Okay, thank you. I have a second question for from the audience. I have an elderly grandmother with cancer who lives with us. We've decided to avoid contact sports and opted to enroll our child in track to minimize the risk of spreading disease. How do you recommend, Dr. Vilay, helping my teen cope with this situation?
Sure. I mean, I think a lot of these things are an opportunity for parents to really educate their children and to really teach them, because we really are the best examples for them in life. And so one of the ways to, obviously mitigate those transmission risks are, wearing a mask, first of all, if you're kind of indoors, whenever it's convenient or whenever it seems like it's a good idea to wear one. Obviously you don't want to be wearing one when you're actually doing the sport, but if possible, you should wear a mask. And then, as we said, getting vaccinated is also very important, particularly if you have a family member who is immunocompromised and maybe can't be vaccinated. Everyone who can be vaccinated who is around them, that would be a great idea. And then also kind of taking it as an opportunity to check in with your child and seeing if they need any extra assistance. There's a lot of mental health, obviously issues that have gone on, not only with COVID-19, but, just in general. And so it's good starting point to really kind of talk to your child about what they're feeling, what's going on, if they need any additional help. Those would be great ways to aid your child and help them through that situation.
Great. Thank you so much, Dr. Vilay, for your very informative talk on youth sports participation during the COVID-19 pandemic. And thank you to everyone who joined us today. It's time for us all to go on our outdoor walk now. So as we stop the live feed, I really encourage everyone to take the time to enjoy some physical activity outside. It'd be great to see any photos of yourselves walking together that can be posted on the Nevada AAP Twitter feed at AAP Nevada. Make sure to walk for at least 20 minutes, bring some water and sunscreen, maintain social distancing when necessary, and wear a mask, please. We are keeping up to date on the latest recommendations from the CDC and American Academy of Pediatrics, and we'll let you all know when it's safe to resume in-person walks. Please remember that it is very important to stay up to date with your child's regular wellness checks and vaccinations, as emphasized by Dr. Valai today, and make sure to take your kids 5 years and older for their COVID-19 vaccinations. And please remember these vaccines can be co-administered, meaning given at the same time as any other recommended childhood vaccinations. Our next virtual walk with a doc will be held April 10th at 10 a.m. and we hope to see you there again. Stay safe and healthy and have a great walk. Thank you, everyone.